We're back with the breakfast. And just briefly, we'll look at the fact that this is a glaucoma week for awareness. And the World Glaucoma Week was launched in 2010 by the World Glaucoma Patient Association and World Glaucoma Association to provide a forum for anyone seeking to enhance eye health to better comprehend the serious implication of glaucoma. However, glaucoma is believed to be the cause of blindness in 4.5 million individuals, according to the WHO. Glaucoma is a major cause of permanent blindness in India, affecting approximately 12 million people and leaving 1.2 million blind. At the community level, more than 90% of glaucoma cases go undiagnosed. Now, in 2022, it was estimated that 1.4 million people have glaucoma in Nigeria. Now, glaucoma is one of the leading causes of blindness in Nigeria, according to that statistics and the world as a whole. Now, due to the low awareness rate, that's also some statistics saying that there have been more cases of glaucoma caused blindness, which could have been avoided. Now, early detection, according to experts, says it can be reduced and the risks of going blind due to glaucoma. Now, these can be assured by awareness programs and thorough eye screening. But the question for me is, 10 years after the awareness campaign program, 2023 makes it 10 years. How far have we fared? We have professionals, I beg your pardon, who are in the studio this morning. We have a Dr. Onehiregiena. Did I get it?
Yes, Dr. Onehiregiena.
Dr. Onehiregiena is here, and Dr. Mary is also here this morning. Good morning. Thank you for joining us.
Thank you very much.
Good morning.
All right, so quickly, let's even, maybe I'll start with you. Ladies first, that's what they say.
Oh, yes. Oh, yes.
Can you please bring us up to speed now for those who are watching? And we know that this is week for, the campaign and awareness. What exactly is glaucoma?
So, glaucoma essentially is something we define as a multifactorial disorder. And this multifactorial disorder has to do with three different things. We are looking at the intraocular pressure, we're looking at your optic nerve and your visual field. So once these three are affected, then they can cause severe damage to your optic nerve, and eventually it will lead to blindness. Now, the problem with glaucoma now is because once the optic nerve is damaged, it really cannot be repaired or reversed. So it is the second leading cause of irreversible blindness. And so why we tell people that as much as you can, try to come into the clinic, have your eyes tested. Prevention is actually the key to catching it. So it's pretty much nicknamed the silent thief of sight. And that is because it has no symptoms, no signs. People literally wake up blind. So what we try to advocate for people is check your eye pressure, check your optic nerve, and as often as you can, check your visual field as well, because there are certain factors that could predispose you to having all of this. Some of that being that glaucoma is very hereditary. So when you have a family member who has gone blind,
a risk factor.
Oh yes, that's the number one risk factor. And so the thing is, with Nigerians, we're not very health conscious, because I mean, Nigeria is Nigeria. There's a lot going on. So before you even present in the clinic, you really have to have something going on with you. But that luxury is not afforded us when we are dealing with glaucoma. With glaucoma, if you do not attack it early enough, damage would already go on, and that damage cannot come back again. So once you have a family history, somebody has gone blind in the family, or you know somebody who has glaucoma in the family, at least once a year, you're expected to have your eyes tested. Another thing is for people who are very long-sighted or short-sighted. This is just because of the structure of the eye. Patients who are over the age of 40 as well tend to present with glaucoma, and people that are melaninated, that's when we talk about black people, Africans, we have a very serious risk factor, and that's because our iris, what we call our iris, so you have people who have blue eyes, green eyes, gray eyes, and we have our black eyes or brown eyes. Exactly. So with our brown eyes, our iris has melanin in them. And these melanin pigments from time to time can come off and block what we call the anterior chamber angle. And this also can lead to glaucoma. So it pretty much just has to do with either overproduction of the aqueous humor or lack of drainage of the aqueous humor. So that is what we're actually targeting when we are dealing with glaucoma. How do we manage that situation to make sure that the pressure does not continue to cause damage? And as it...
You know what, we'll get back to how we manage because we're almost out of time. But quickly, I'd like to come to you now.
Yes.
And let's talk about the fact that 10 years, 2023 makes it 10 years since, the campaign and awareness has been created. And how would you rate, the level of awareness in Nigeria, Africa, and globally? It doesn't look like for Nigeria that we have recorded some kind of success?
No, we have. I think as a professional body, we take this month, not just this week, which is a glaucoma week, to go out on the streets. And most of the professionals, the eye clinic, actually do a free eye pressure check, right? And we have a lot of people on the streets canvassing for pressure check, right? And if you even have issues like blood pressure, it's very, very important that it's a disposing factor to having glaucoma. Not to put fear into anybody, as much as it is irreversible, it is also preventable. So it's a leading cause of blindness, and it's also a preventable blindness.
You also remember that I reeled out statistics, and we're looking at 1.1, 1.4 million. Would you say that that's a lot of progress in terms of awareness for Nigeria?
So the thing with glaucoma is, to be frank with you, I don't know what causes glaucoma, right? But I know what are the risk factors of glaucoma. So the first risk factors are genetic, right? So if your parents have BP or glaucoma, there's a tendency that is passed down to the offspring. If you're more than 40, everybody's going to age. Everybody's going to be more than 40. Those are risk factors too.
No, I understand. I understand all of that. Well, my point is, we're looking at the level of awareness, and the lessons will be, the question will be 10 years after. What are the key lessons that we've learned? For Nigeria now, if we look at statistics from 2022, saying that 1.1, 1.4 million people have glaucoma in Nigeria, is that really impressive? Do you say, if we say that we can't prevent it, we can prevent it, but there's no cure to it.
Yes.
Are we saying that we have recorded some level of awareness? Are people checking? Because if you have this figure, that's a lot.
Yes.
1.4 million is a lot.
Yes.
Numbers or persons who probably have glaucoma. So, in terms of the level of awareness, and since the inception of this campaign, however, do you think that we have done enough to create the awareness to reduce persons that have glaucoma? Because if you dictate early, you can treat. That's what you said.
Yes, I think we could even increase the number of people being captured. If we go into the villages, the rural areas, there are a lot of people that are not being served there. So those people too can be captured, and being able to go to the roots, to the grassroots, where healthcare is not really at the optimal, right? So I think we can do a lot more in that aspect, where I think largely we've done a lot. The government have also done a lot. The state government, Lagos state government, we work together with all the health professionals, the eye care people, the ophthalmologists, the optometrists, we all come together to make sure that we save everybody.
Okay, so let me get back to you now, Dr. Mary. So quickly, what do we now do, to reduce the number of persons who are on this list? Now that we have this, and we're just talking about cases that are reported, we haven't looked at cases that are not reported. But generally, what can be done to reduce the pressure and to ensure that people are aware?
Okay, so like he said, the challenge we have especially is with the people in the rural areas. So when you have a case that is underreported, most times you are not getting the right statistics or the accurate number of people. So what every eye clinic in Nigeria or around the world at this time is trying to do is offer free eye tests all through this week, starting on Sunday and until Saturday, frankly speaking. But because Lagos decides on Saturday, we're there till Friday, just offering you free eye tests, having your pressures checked. So you really don't have to have any problem. Just walk in, take advantage of the free eye test. Once you have your eyes tested, then it's a starting process. Once we're able to know, okay, everything is fine as of this year, next year you take an advantage again. When they look at you and there's anything suspicious, then they flag it and then they start further testing. But when you don't present to the clinic, there's almost nothing that can be done. And like we said, it's silent. So you will never wake up saying, oh, I'm feeling pain or anything. One day you just wake up and then there's no more vision. So that's why we always advocate people come into the clinic. Wherever you are, most clinic at this time, they are running free eye tests. So just walk into any clinic, have your eyes tested, and then let's see what happens from there.
All right, then we have to go for the want of time, but we'll definitely have this conversation some other time, hopefully still the week or the month of it. And so we hope that we have you some other time in the studio. Thank you so much, lady and gentlemen, Dr. Mary and Onia. I hope we got that well. My name is Messi Iboko, and that's the size of a conversation this morning on The Breakfast. We'll join the newsroom at 9 o'clock for the news brief. Please stay with us. Good morning.